In this session, we will be learning about classification of pain. This compilation is made by Dr. Anurag Agarwal, Vice President of UP Chapter of National Association of Palliative Care for Ayush and Integrative Medicine. Acute pain, it is less than 30 days old. It may be post surgical pain or pain due to trauma, labor pain, etc. It always indicates tissue injury. Neurochemicals may be involved. Autonomic responses are there. It is self-limiting as healing goes on. Intensity decreases with the progression of healing. Acute pain, it is a symptom and it is protective in nature, and it is less likely to have psychosocial impact. Chronic pain, in sharp contrast, it is more than 3 months old. Example, chronic low backache and arthritis, trigeminal neuralgia. It may be multifactorial. There may be neuroplastic changes in CNS. It may lead to disability and vegetative responses. It is unremitting and progressive. Intensity does not reduce, and it is a reminder of poor prognosis. Chronic pain takes on the characteristics of a disease. It is also having psychosocial aspect. So, pain has basically two components. One is nociceptive pain, which is due to tissue injury, and the other may be neuropathic pain due to injury of the nerve. Nociceptive pain is caused by mechanical, inflammatory, chemical or thermal stimuli at the somatic or visceral tissue nociception, whereas neuropathic pain is caused by damage in peripheral nerves, nerve roots or within CNS. This is the example of Herbst-Joster. Classification of pain, again nociceptive pain may be somatic, it may be in bone, it may be in soft tissue. Visceral pain is it may be in capsule, bowel, or it can be cardiac pain. Neuropathic pain is peripheral, it may be central, it may be of sympathetic nervous system. Now, nociceptive pain may be inflammatory pain due to tissue reaction, it may be proportionate to tissue injury, it has protective function and it responds to analgesics. Whereas, neuropathic pain has much to do about abnormal functioning of the nerve, it is disproportionate to the stimulation, it serves no protective purpose, always it is a pathologic type of pain, dysesthesia, allodynia, hyperalgesia may be there, it may be burning or stabbing, and there may be variable response to opioids. Persistent pain may be nociceptive pain, pain signaling pathway intact, and neuropathic pain is pain initiated or caused by a primary lesion or dysfunction in the nervous system. It may again be disease affecting the somatosensory system. What is the difference between nociceptive and neuropathic pain? Nociceptive pain is stimulation of peripheral nerve fibers by noxious stimuli. Now, these stimuli may be thermal or they may be chemical, whereas neuropathic pain, it may be due to damage or disease of any part of the nervous system. Nociceptive pain is sharp, dull, continuous, whereas neuropathic pain may be burning, tingling, electrical, stabbing and feeling like pricks of pins and needles. Nociceptive pain may be due to abscess or trauma. Neuropathic pain may be due to phantom limb pain, herpes, diabetic neuropathy, etc. So, phantom limb is when I do not have a limb and still I can feel pain in that limb. Nociceptive pain is somatic and visceral. Neuropathic pain is peripheral and central. Nociceptive pain responds to NSAIDs, opioids, and neuropathic pain do not respond to NSAIDs or opioids, but it responds to TCAs and ACDs. Nociceptive pain is mostly acute pain and neuropathic pain is mostly chronic pain. Nociceptive pain may be having a psychological impact, whereas neuropathic pain may lead to psychosomatic disorders. Causes of neuropathic pain may be trigeminal neuralgia, post-herpetic neuralgia, diabetic neuropathy, phantom limb following an amputation, multiple sclerosis, pain following chemotherapy, HIV infection, alcoholism, cancer, atypical facial pain and various nerve disorders. Common features of suggestive of neuropathic pain may be paresthesia, an abnormal sensation which is spontaneous or evoked, dysesthesia, an unpleasant sensation which is spontaneous or evoked, hypoesthesia which is decreased sensitivity to stimulation, tactile or thermal, and both are frequent. Hyperesthesia, increased sensitivity to stimulation, tactile or thermal, and both are very rare. Hypoalgesia, it is diminished pain response to a normally painful stimulus. Hyperalgesia, an increased response to stimulus that is normally painful. Allodynia, pain due to a stimulus that does not normally activate the nociceptive pain. Components of neuropathic pain may be spontaneous pain and provoked pain. Now, spontaneous pain may be continuous or intermittent. It may be stabbing sensation, pins and needle sensation may be there, throbbing sensation may be there, burning sensation could be there, electric shock like sensation could be there, numb sensation could be there and shooting sensation could be there. And provoked pain may be allodynia or hyperalgesia. It could be mechanical or thermal. So, we can see now neuropathic pain, it starts from the tissue and moves towards the brain through the spinal cord. And now, we can give medicines which may work at the level of brain, the level of spinal cord and at the local level. Why cancer causes pain? due to direct tumor invasion, soft tissue, bone, nerve, vessel, viscera and organs may be affected. Pain related to cancer treatment due to CT, RT and surgery. Pain due to disability, which may be because of bed sore, constipation, post-herpetic neuralgia, etc. Pain unrelated to cancer or its therapies could be because of arthritis. So, types of pain caused by cancer may be acute pain, chronic pain, acute or chronic, breakthrough pain, incidental pain, crescendo pain and terminal pain. Here we can see the invasion of tumor in blood vessels. So, this is cell with genetic mutation, it multiplies, hyperplasia, leads to dysplasia, in situ cancer and now invasive cancer involves other organs. And there could be compression of nerve also. So, brain tumor could be there, there may be tumor in bone, there can be tumor in organs. When we are talking about tumors, they could be benign or non-cancerous or malignant, which is cancerous. Pains related to cancer. Now, neuropathic pain after chemotherapy, it could be severe burning of sensation in toes. Post surgical pain could be there, pain due to mucositis is common after radiotherapy and pain unrelated to cancer or its treatment is only 3%. Cancer pain means it could be either acute pain, it could be chronic pain and even it could be breakthrough pain coming in between. There may be constant pain, there may be intermittent pain and again it could be nociceptive and neuropathic pain. So, there could be combined pain too. What is total pain in cancer? We have learnt about the physical pain, which is due to the disease. It could be because of other symptoms, it could be because of fatigue and decline in health. Then there may be social pain too, in relation with the family, role in social life, it is almost kill, due to work life which has come to a standstill and more important is financial loss. The psychological pain is there due to depression and anxiety, there is grief and fear of death, there is anger that why did I get cancer, why not that person is smoking and still he has not got cancer, and we feel adjustment disorder to the various conditions. Spiritual pain is also there due to existential issues. Why was I born? What was my purpose of life? These are the questions which come to the mind when we are going to die. Now, there may be faith issues related with God, there may be religious beliefs and again personal values and ethics. All these together make total pain. So, while the doctors are treating the physical pain, again if we are not treating all other pains, the patient is not going to get relief. So, it has to be treated as a total pain. So, again we have to revise that what is total pain? Total pain is physical pain, social pain, cultural pain, psychological pain and spiritual pain. Thank you.